body piercing, body art. Yeah, become very, very fashionable these days. We've had tribal marks since time immemorial. Today I have a friend of the program, consultant plastic surgeon, former CEO Kolebu Teaching Hospital, country director, Operation Smile, and many others which I'll add later on. Dr. Opoku Wari Ampuma Odadie is with me in the studio today, and we're going to be looking at what exactly are you doing to your body when you get a tattoo. These days, women are using tattoos for eyebrows and many other things, right? And we need to know what exactly we're doing. Doc, you're welcome.
Thank you.
Sorry. Yep, you're welcome. Akwaba.
Yeah.
Hey, what's been happening? We haven't had this pleasure in a while.
Yeah, well, we've been working for God and country.
For God and country. A stint as CEO of Kolebu Teaching Hospital. We're most proud of you. And now you just tell me quietly you teach and you practice.
Yes,
But you're doing lots more than that. Yeah. I also understand that you're head of the chairman of the board of trustees for Interburns, International Network for Training, Education and Research in Burns. So that tells me we have a lot of programs downstream. But you're welcome. Okay, Opoku, the skin is the biggest organ. I stand to be corrected. Am I right?
yes.
I think there's a bit of hollowness in his microphone. Try that again. Yep.
Yes, the skin is the largest organ in the body.
Mm.
And it's also a very important organ because it's through the skin that we interact with our environment. So the skin has got specialized sensors through which we feel and manipulate our environment. And then the skin is also something that we use to identify ourselves.
Okay.
And so on. So whatever we do to the skin is really important. The skin also plays many other roles, including even metabolism,
Okay. Right.
management, how we manage heat in our body, and so on. So the skin is very, very important structure that we have to treat with care because any problems in the skin can actually affect the rest of our health.
Okay. Whether accidentally or deliberately, anything we do to the skin, anything that happens to the skin is of serious concern. Okay, we're just relocating Doc so that we can get a better mic feed. Yep. Doc, if you can just say hello again, let me be sure. Well, slightly better, but listeners, do bear with us. My producer Ziggy is zipping around trying to sort things out. There's some music playing in the background. Okay, so the skin is important, right? But then this whole issue of, for deliberate and, can I say, cosmetic reasons, right? We're doing certain things or call them modifications to the skin. For example, tribal marks, tattoos. Is that not directly, should I say, compromising or harming the skin?
Okay, so a tattoo is any permanent modification that is done to the body, to the skin,
Right.
by injecting ink, dyes, pigments, into the deeper layer of the skin.
Okay.
It's called the dermis. The skin has got two main layers. The dermis is the superficial, but that's what we see.
Okay.
Right, and then the dermis is the deeper part. Okay, and so once you inject these dyes or pigments into the deeper part of the skin, the dermis, it becomes like a permanent feature, of the skin.
Of the skin.
And so that's what we call a tattoo.
Right.
Whereas, and so the tattoo can be something that is, done deliberately, like what people go to the tattoo parlor to do,
Right.
or it can be something that is accidental.
Okay.
So like when people get into a road traffic accident situation or they get dragged on the ground, we a street where sand and gravel
So in that,
is embedded
okay.
deep into the skin, it forms permanent features or permanent scars in the skin, and that's also called traumatic tattooing.
Okay.
So, but for the purpose of this discussion, we are talking about
The aesthetic, the deliberate cosmetic introduction. Okay.
And then the piercings are the piercing is when you puncture,
right,
or you cut, the skin, to create an opening, through which maybe jewelry or something.
Studs, right.
Yes, and this can be done, commonly, culturally, with the earlobe.
Earlobe, right.
And then now people have become adventurous, and now we are seeing pierces
all over.
Eyebrows, the nostrils, the tongue, the chest, the
lips, nipples,
the belly button, going
way down below sea level. Right. Okay.
And all that. So people are getting adventurous with these things. Yes.
Okay. Right. Let me. And for those of you who have indicated, I do hope you can hear Dr. Opoku Wari Ampoma clearly now. Yes, I can hear him clearly, and I do know there's been an improvement. But do let me know. I see a couple of messages who initially were, complaining. But Doc, let me come to this. One of the reasons last week I had the National Blood Service in the studio, and we talked about blood transfusion, blood donation, and all that. Right. I had intended to follow up later with some concerns about how we process our blood-borne diseases, and so on and so forth. So it led me into researching into this, let me call it more than a craze of body art. And I realized, to my shock, and you can correct me if I'm wrong, there doesn't seem to be any direct regulation of those who practice these body artistry and body arts, for example. Is there anybody in charge of these?
But I'm not aware of anybody that is specifically regulating this industry. I know that they have their own industry where they, they have the associations.
Right.
Okay, but associations are something that you do
voluntarily. Right.
So it's not enforceable, and so it is a matter of concern that all these people providing these kind of services should be under some kind of regulation, and this is very important because the skin is a very, very vascularized structure. That is, the skin has got a lot of blood vessels.
Yeah.
So the skin is one of the most vascular organs in the body.
Okay.
And so a lot of blood flow. So once you pierce into the skin, you come into contact with blood, and many people who are part of this will tell you that once they have this procedure, there's a bit of bleeding that happens.
Okay.
With it. So it implies that there's a certain risk associated with these procedures, in the sense that any blood-borne disease can be transmitted through this process, especially when you are using instruments or needles, blades that have not been properly sterilized, and so you must, if you're going to have a body piercing or a tattoo is being done, you must consider it like how you would consider a minor
surgery
procedure, so that all the standards and protocols should apply. So it means that when you do these things, you are at risk of contracting some of the bacteria that are on the normal skin flora. That's like what we call staphylococcus, as all these skin, bugs that are usually found on the skin.
We can cluster all those infections.
But then there are also the dangerous infections like hepatitis B, hepatitis C, HIV. All those infections can be contracted through these procedures, and that is why it's important that regulatory control must be brought to bear on this industry.
Okay, right. I stand to correction, but I was not able to, should I say, determine any direct regulatory. We have the HEFRA, Health Facilities Regulatory Authority. Of course, if they were dentists or medics, then they would be under the Medical and Dental Council, and many other, statutory bodies that regulate the practice and therefore promote, regulate, and should I say even maintain safety of the practice, right? And so this is one concern, right? Doc Opoku Ampoma has also said that, of course, there are many structures in the skin, and once you're piercing into the lower structures, especially, you are damaging and compromising the function of the skin. The breakage in the skin also introduces you to many other pathogens that may cause you problems, including the big telltale ones, your hepatitis, your HIV, and so on, right? If you have any questions, concerns, share with us. I do hope that the sound quality is better. We've made some adjustments within the studio. Okay, Doc, let's see if we can get back into the flow. So these are known concerns. As a consultant plastic surgeon, right, you're looking at damage many, many times or more often, traumatic damage. But this is deliberate. Should we be concerned? I mean, these days I notice women, even eyebrows are now tattooed on or used, dyes are used, right? Should we be concerned?
Right, yes, we should be concerned. But I would also say that as plastic surgeons, we actually sometimes use medical tattooing for reconstructive purposes.
Okay.
So you have a patient who's had damage, maybe to, let's say, maybe the upper lip,
okay,
or any part of the body, let's say the eyebrows, for instance. You need to maybe you've had stitching, you've started to stitch it or repair the place, but then it has affected the hair growth, for instance.
Okay.
So the eyebrows can be tattooed on.
Okay.
So and sometimes people have got very unsightly scars. We use medical tattooing to camouflage the scars and so on.
Okay.
So
to mask it.
Yes, to mask it, exactly, to make it less unsightly. So this is not to kind of condemn,
right? They do have a legitimate purpose.
Yes, they do have legitimate purpose. And,
if done properly.
If done properly.
Professionally.
Yes, and they can be used to enhance beauty and so on. So I don't want us to throw out the baby with the bathwater.
Okay.
But what we are concerned about is the fact that it is largely unregulated.
Okay.
And there are real concerns about possibility of transmission of certain diseases. The other issue also is that when you are before you have this procedure, the provider, if he's well trained, should find out certain facts from you. Let's say if somebody is on a blood thinner, for instance, people on blood thinners, they tend to bleed excessively.
Right.
So such people are not suited for such procedures.
Okay.
There are also people who have certain conditions like some type of things like psoriasis and so on, who may will get a flare up of this condition when they are the skin is bruised, traumatized, and so on. Okay, so and then if somebody is somebody is a diabetic and is not well controlled, they are more prone to skin infection. So breaking the skin, introducing this would also be a trigger for infection. Then commonly, patients, there's we have a large number of our population who are prone to what we call keloids, abnormal scars.
Right.
Keloids are abnormal scars that grow beyond the original trauma that caused the scar in the first place. Okay. These taking scars, they just keep growing, become very unsightly and very disfiguring. Okay, so you need to find out whether the person has a history of keloid formation. Then you avoid this in such people. See, so but when you are in an unregulated space, then some of these precautions are not taken. Okay, and then secondly, so apart from the kind of exclusion criteria, where that there are certain subpopulations that should not be having this kind of procedure, there are also another criteria, which is the age.
Right.
So where regulations work. When you are not of age to be able to give consent, they are not allowed to.
So we can use age of consent as a threshold.
As a threshold,
right.
Exactly. Because if a young schoolboy comes to a tattoo parlor and says, "Look, I want to, I'm a fan of, let's say, Shatter, or I'm a fan of Stoneboy or whatever," and he wants to tattoo them, they are young. They don't know the implication of their choices. So you don't just go ahead.
Serious decisions.
Exactly. These are serious that have.
And you should be of age to give consent.
Exactly. And that even in some of our institutions, for instance, I know that for some time ago, institutions like the military, police, and so on, if you have tattoos, they will exclude you from, when they are recruiting and so on. So these have implications. And then, of course, when you go to the corporate world, our society is generally a more conservative society.
Okay.
So some of these things actually affect your prospects, because you would tend to be prejudged. Whether you may be a very good person. Of course, having a tattoo or not is not a determinant of character. But then definitely you'll be judged. And so these are important considerations when you want to do these things in the environment. And then so that is looking at before the procedure, the kind of precautions or the kind of questions that should be asked to appreciate
some
whether
kind
this
of
person's
pre-qualifying indicative assessment.
Exactly.
Okay, but Doc, before you move on, I'm glad you've got your flow now. But so doesn't this suggest some minimum threshold with regards to qualification of the person you contract to undertake this procedure for you?
So else, in advanced countries where tattooing is a contract is well recognized, for instance, they go through they have some formal training where they go through. So they have standard devices and standard dyes. In fact, even the kind of dyes that they use, because for a lot of these tattoos, we use pigments and dyes.
Right.
And some of these dyes contain heavy metals. You know the danger that exposure to a large dose of heavy metal can cause to your kidneys and so on. So even the type of concentration of heavy metal in the dye is even regulated, so that you can't, because they are industrial dyes. And then they are the ones that are used for human. But sometimes in our environment, people are using industrial dyes for human, purposes, and this introduces toxins into the body. So elsewhere, these are all kind of regulated, and they even check. Sometimes they even come and even check your dyes. They even look at come and check even the state of how clean you are keeping them, and whether even the state of bacterial contamination. Because if you are introducing these things directly into the body. You see, anything that you introduce into the body, it must be sterile. It must be as clean as possible. It's just like when we are giving IV injections or IV drips and so on, or we are giving vaccines and so on. They are supposed to be kept stored properly and are supposed to be sterile.
And we raised a lot of fuss about even these ones, even during COVID.
Exactly.
Right? People had questions, but it seems that these questions and the certain degree of vigilance is lost when it comes to
because we are not thinking. So we think it's just something, just going for this thing. It's a fun thing, but it is actually something that is serious and can cause a lot of problems. So if it's not done properly, or the dye content is not stored properly and so on, then you're going to have the situation where you are introducing just regular bacterial contamination, which can make some people very sick. Okay. So, of course, that will be shown by some people who develop some redness, itching, redness, bruising, blistering itching around the place where the tattooing or whatever, the abrasion or whatever was done. Okay. And this, if in an somebody who has a suppressed state of immunity, it can spread and make them very, very sick. Okay, or it can cause abnormal scarring and a poor result as a result. Okay. So that is one of the things. And then, of course, you can also, sometimes, if it's not done properly, there are some parts of the body where the certain blood vessels or nerves are very close to the skin.
Right.
So you can actually damage these blood vessels and nerves. So people who are trained to avoid some of those areas, so they don't cause nerve damage or damage to blood vessels.
Okay.
So,
28 minutes past the hour of 2. This is getting very, very, very interesting. We're talking about the full health impact of tattoos, tribal markings, body piercing, and some people say body art, right? Yes. Your body is the only thing you've got. You're not going to get spare parts at Kokumpe or anywhere. But yes, this has become a trend. And it's not a matter of social status or education or whatever. Everybody seems to want to have, most people are quite okay and comfortable with having tattoos. We're considering the full health impact with Dr. Opoku Wari Ampoma. I like calling his full name. I love the name, man. He's a consultant plastic surgeon. Former head of the Department of Burns and Reconstructive Surgery. He stepped down, he stepped back a bit. He's doing more stuff elsewhere. He's a former CEO of the Kolebu Teaching Hospital. He's the country lead or country director,
Country medical director.
for Operation Smile. That's the one that deals with cleft lips, right?
Yes.
And then you're also the board chair of Interburns. Tell us what's Interburns.
Interburns is an international network for training, education, and research in burns.
Okay.
So it's a body that builds capacity in burn care.
Okay.
So we are in about 18 countries across Europe, Middle East, Asia, and Africa.
Okay.
So
Right.
building capacity for
Okay.
various burn.
He's a good friend of the program. He's one gentleman who I went to see with a disturbing growth on the side of my face. I thought we were just talking. The man walked me into theater. He had set up his team already. He says, let's do this. I kid you not. I do recall that I could hear Joy FM in the background whilst I had that. To him, it was a minor surgery. To me, I was scared stiff. But I haven't had a problem since then. All right. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're looking at the full impact, health impact of tattoos, tribal markings, and body piercings. Opoku, let me swing quickly before you get back onto your role. In the past, especially during Ghana Month, I've done tribal marks with you. They go back way centuries back, right? Again, to identify ourselves.
Yes.
What can you say about that so that my listeners add that to the discussion?
Yes, okay. So tribal marks, historically, tribal marks were, kind of body scarifications.
Okay.
So these are intentional scarification of the skin at various parts. So some that use the cheek, the face, the forehead, various other places, and it was a way of one identifying. People belong to a particular tribe.
Okay.
Identify a subgroup cohort within a tribe. Sometimes warriors do that because for ritual purposes they kind of fortify themselves before battle.
Okay.
Sometimes it's also used to brand slaves. Like the way you brand animals. It was used, some of these kind of
This
things were
belongs
used
to me.
Yes, exactly. You belong in that kind of
Or
thing.
this is a pedigree slave.
Exactly, so on. So across different cultures, there were various reasons why these scarifications were done. Okay. And most of the time, the traditional way, what they do is that they make a cut and then they put usually ash or soot into it. And then when it heals with the scar, because they deposit in the deeper part of the skin, and then it becomes a permanent, cut or mark, on the face. And so this is something that was being done some time ago. So depending on which place you go to, in some tribes, like royal people who are royals are not supposed to have any marks at all, blemish on their body. In other places too, it is used to identify certain subgroups of people and so on. But then in the modern day, we've tended to kind of shy away from some of these marks, and then many people now see it as like a permanent disfigurement, because they don't want. It's something that people ask them about, because now, especially when you go, you travel outside the country or you go to certain cosmopolitan places, everybody wonders what. So
what happened to you?
So we've had a steady stream of people who come to have these tribal marks kind of corrected, modified, exactly.
Okay,
correct. Yes.
All right. The reason I ask this is that we can't run away from the permanence or. Literally, the permanence or the long-term effect of tattoos, tribal marks, body piercing, and so on and so forth. Many of these are deemed irreversible. I remember I had a client who got a tattoo to get back at her husband, right? And it was at the low part of her back, and with certain outfits, it shows. But after a while, this whole conflict had passed, and then she was asking, is there a way? I know there are laser techniques and things, we'll get into some of those, but are these things permanent, and can we consider, or should I say, move the concerns we had with the other ones to the tribal ones we just described?
Yes. So if it is done by a professional, then they tend to be permanent.
Okay.
There are some amateur tattoos which in which
The
when
ones
they
that are
do
like
it,
transfers.
yes, yeah, but because they don't, the amateur ones, because they are not being done in a professional setting, they tend to deposit the pigment very superficial in the skin.
Okay.
So those ones are easier to deal with, and they kind of fade over time, or they are easily kind of handled,
Okay.
cleaned off. But then with the professional ones, they tend to be permanent, and so we have to look at.
They are going into the deeper layer, the dermis of the
deeper
skin.
layer of the dermis. Yes.
Right.
So those ones tend to be permanent, and same thing goes for the tribal marks. So when somebody has that condition, they want it to be treated. There are various techniques that we use to kind of improve upon it or eliminate it altogether. But I'll share a story of one medical student who fell deeply in love, and then it was his first relationship, so he thought that was it, and he tattooed the name of the lady on his breast, on his chest, and then the relationship didn't last very long. He was heartbroken. Now, anytime he looks in the mirror, it reminds him of his heartbreak. So he came to see us, very desperate to have it removed. So that's why it's important that you are very careful about some of these.
Be careful
decisions.
about these decisions.
Yes.
Goods once bought are not
are not returnable.
All right. Okay, everybody's telling me the sound is great. All the way in Maryland, Dede says yes, they can now hear you loud and clear. Sorry about that problem in the beginning. We're talking about the health impacts of body tattoos, body piercing, tribal marks on you. If you have any concerns, share them. WhatsApp is 055 11 11 997. We're live on Facebook, YouTube. Let me activate the phone line 030 221 6541. I'm in the company of, I like calling him the full Monty. Opoku Wari Ampoma, Dr. Opoku Wari Ampoma. Of course, yes, he's an older dear. I went there for sixth form, so yeah, we have that rapport as well. Okay, so near permanent.
Yes.
The more qualified or confident that person is or trained, they go deeper into the skin. We've talked about infections and other things. I've read, Dr. Ampoma, about where some particles, indeed I've read even about nanoparticles that go and lodge in lymph nodes and other parts. Does this damage go further than the skin?
Yes, so that's what I'm saying, that they introduce other pigments, a dye, into the deeper parts of the skin. Yes, and so these pigments can be, or sometimes ink, various types of ink. So these pigments can be picked up by some kind of cells that we call lymph nodes. So they can travel from the site where it was deposited into the regional lymph nodes and so on. Sometimes you can even see, if it's not done, we can even see it streaking, like the pigment.
The color is
you can
moving.
see a streak, yes, because it's being carried by some of these cells and it's traveling along what we call the lymphatic channels under the skin to regionally. So it is serious business, depending on how much quantity that is deposited and so on. You can have various complications. That is why I was also talking about the type of dye that you use, because the type of dye or the pigment that you're using, yes.
Into the
so
skin.
we have industrial dyes that we use in the textile industry and so on. Okay, and then we have medical grade dyes that are safe to introduce into the human body. But then, if in untrained hands, they will pick anything at all.
Anything that sells.
And I mean, you can even look at our food industry now, where people are introducing Sudan,
all sorts of dyes, into oils, into fish, into meat,
and so on,
into fruits, vegetables.
Exactly. Because even for what we consume orally, where we are even more conscious of it, people are even introducing some of these things that are dangerous. How much more some that they think, we are not ingesting it, so they think, once I'm put into the skin, then it's safe. So sometimes people cut corners and so on. That's why regulation is very important.
It's important, and the absence of it.
Yeah.
Okay, I still stand to be corrected. The full direct absence of it is scary.
Yeah.
It's frightening.
Yeah.
Okay, let's bring in ear piercing.
Yes.
Right. Hey, she's of age, she wants to do it now. Guys are doing it, girls are doing it, men are doing it, women are doing it. Are the concerns the same?
Yeah, so anytime you are doing something, like you are making a cut into the to the skin to the body, you know that there's a potential complication. Just that, okay, if you take the general population, people who are generally healthy, and if it's in a clean environment, usually the consequence tends to be low. But then it is still a real risk.
Right.
So it's important that whatever is being done is to be done to the highest standard possible. Once you are introducing anything to the skin, you must know that the potential complications, and it's something that people don't think about. And also, even where you are doing the piercing, for instance, where you are placing whether it's jewelry you want to put, the environment and so on is really, really important. The implement you are using, because you can, I mean, if you take an old needle blade, rusty, and then you introduce it, it's got tetanus spores on it, you can get tetanus from it. You can also get all these regular, like what is called cellulitis, where you get skin infection, that the skin becomes red, swollen, blotchy, and so on. You can get that, and can make you very sick. And so you are not spared of this complication, so there's no need to be careless. You need to make sure that the place is clean. It's like you're doing a minor surgery, for instance. So it's very important. And I know that there's something that is it's what do you call it? It's a fad. Now some people, guys are piercing their ear and so on. I've also had senior men, people who have now outgrown their youthful wild days, and then now they want it reversed. So, so
they want you to
close the hole.
To close the hole.
Yeah.
And
so,
where the piercing.
Yeah, the piercing. Yes. So sometimes we also do that. But then the more common complication that that people present with is keloids. Because keloids are very interesting in the sense that they tend to be more common between puberty and, let's say, when you're about 50 years.
Okay.
So the same child, maybe when a child is born, most girls, they have their ear piercing, no issue at all.
Right.
But then the same girl in her teenage years, she goes and gets a piercing, maybe she wants the second or third hole, and then that one develops into a keloid, and then they have to come into, it becomes unsightly, they have to come into hospital for formal treatment.
Okay.
So those are the, and then of course, it depends on where you go to for the piercing. Okay, if the instruments are not sterilized, or if they are kind of not doing proper sterilization, there's no proper standards being maintained. Infection control, of course, you can pick up an infection from somebody, because whatever is used through the piercings must be a single use only.
Okay.
And discarded. But I mean, when people are cutting corners and people are not, keeping up to standards, some of them do recycle these things, and that's where the problems arise.
Okay. Good afternoon, Nortey. Please find attached a picture of my 7-year-old daughter who has these marks on her legs due to dry skin. Please, is there any remedy for her? Any remedy for her will be deeply appreciated. Julie from Malam. I can't see the picture clearly. Maybe I'll send it to Opoku later and see. Okay. He is a consultant plastic surgeon. He's into reconstruction. We can't see what you sent. It may be an issue for a dermatologist.
Yes.
Right? Who specializes in skin as well. So having said that, right, let's know the scope and the referral parts that we're talking about. If you have any concerns, questions, share them with us. Phone line is active 030-221-6541. What have you done to your skin? Have you tattooed? Is it just a light eyebrow? Some of them are big, thick, like bicycle handlebars. Yeah, and they are permanent, so to speak. And we need to look at what is being used. Doc has expressed concern about the type of dyes being used and should I say, injected into your body or your skin, right? And then, of course, the body tribal marks and piercings and cuts, earrings, and so many other things, right? We need to be concerned about them. There seems to be little by way of formal regulation with regard to training, etc. That's where the concern is. Don't forget that we're also talking about an upsurge in certain age groups where it comes to HIV and certain other things. Okay, so these could be fueling. I remember the HIV, issues were fueled in some parts of the world by men having sex with men or by intravenous drug usage, which is also akin to blood sharing or body piercing as well. They're using the same needles. So guess what? Whatever is being used to pierce or, should I say, design your body, these are the concerns. This is from Dede in Maryland. Let me just see what she's got here. She says, is any place of the body fair game to pierce and tattoo? Dede Komonahi. I've watched documentaries where different colored dyes are injected into the sclera white part of the eyes. This is from Dede in Maryland.
Yeah, so like I said, as science advances and people become more adventurous in their what they desires,
I'm glad you said adventurous. I would say more insane.
exactly. I didn't want to use that word, but
don't worry, I'm qualified to use it. They should come.
And you see, you will find practitioners who are ready to push the envelopes, put the limits of what is
permissible and can be done.
Exactly.
Right.
So people do all sorts of them. There are people who want to. Somebody wants to change their body to look like Spider-Man, or there's all sorts of things that people desire. So, of course, like I said, at the end of the day, whatever it is that you want, you must make sure that you are going to somebody who is qualified, who is registered, who is regulated. Because even in other places, even the tattoo artists, right, they keep a record of who came in and what kind of tattoo they had.
Right.
So sometimes even when people get missing, they can even, if they have a tattoo, they can even use that for forensics. So then,
and some are even doing it to, should I say, hide the identity.
Exactly.
Or change their identity.
Exactly. So I mean, we've had people who come and say, "I want to change my fingerprint."
You want to change your fingerprint,
and so on. So these are things that should be properly regulated.
I've got this picture up here.
Yes.
Good afternoon, Nortey. I have this keloid on my chest. I started injection at Kolebu, but the medicine makes me sick. It sometimes makes me, I don't know, he says sore, but it itches too much.
It's not because the picture is a typical picture of a keloid. So this probably means I've started as a small pimple on the chest, and then it becomes it grows, and then it spreads over a wider area, and it can be quite disfiguring, especially if it's around the the chest area for women.
It becomes sore. Sore is the word. S-O-R-E.
Yes. So sometimes depends on the we have a drug, which is a steroid that we inject. Basically, these scars, abnormal scars, are caused by your body producing too much of a protein called collagen. Collagen is a protein that you find in the body
for repair,
and you use it to repair processes. But when you produce the collagen, after let's say you had a cut, the body produces collagen to kind of bridge that gap, right? And when you've produced enough to break the gap, the supply is supposed to cut off. Basically, it's supposed to be a certain balance there. But for people who produce keloids, it just keeps overproducing.
And it keeps producing.
It keeps producing. So then it heaps up. So then it itches, it's a bit sore. It begins sad, and it spreads beyond the original area where the whatever injury or things that caused it. So the steroids come in because the steroids help to suppress the cells that produce the collagen.
The overactive cells.
But then during the process of injecting the steroids, steroids will have some effect on the rest of your body, like you said. So for women, sometimes it may change even the way your menstrual cycle, comes and so on. And you must also be monitoring the patient, because too much of steroid can reduce your, affect your sugar metabolism. So you have to check your blood sugars and so on. And some people can make even their pressures go up and stuff. So that has to be monitored. But then when too much of injection is given at a particular point, it can make the skin out the skin. And so that's where you get the sore.
The sore.
I mean the ulceration happening. So it can be as one of the complications of the injection, but it can be managed. So for her, if it's making her sick, then you can kind of rather regulate the dosage, dosing, and the administration to see how best.
So she needs to come back to whoever the provider is.
Yes. So she needs to.
All right. I hope that helps you. This is the dry skin matter here. The legs that I said wasn't clear.
Yeah. So some people have got are born with dry skin.
Right.
But dry skin can also be as a result of some vitamin deficiencies and so on, and some other disease conditions. So I think you can get a dermatological assessment, and if it's found that there's nothing wrong with it. It's just that she happens to have dry skin. I also tend to have dry skin.
Okay.
So what it just means that she has to be moisturizing the skin.
Your dry skin is not because you went to Presec at a time when water was scarce. Okay, so it could be vitamins, it could be other things. It needs to be checked for that child. Okay. All right. This one says, "Good afternoon, radio doctor. I'm about to undergo major back surgery, but I have a serious problem with keloids. What can I do before or after the procedure to prevent or limit keloids?"
So that's a very good question. So once it's established that you do have a problem with keloids, this is something that you should let your surgeons know.
Okay.
And so usually what we do is that they work with the plastic surgeon so that within, let's say, 2 weeks of the surgery, okay, they can see the plastic so that there's one we can use the steroid injection along the edge of the scar. Some people would give it at the surgery, but the downside of that is that sometimes it actually prevents because you need to produce collagen, and this injection is going to reduce collagen formation. So, but you need collagen formation to also get the wound to heal. So if you inject it at the time of surgery, sometimes the wound doesn't heal when the wound can break down. And for spine surgery, if you get the wound breakdown, it's actually a serious complication.
Right.
So what you do is that if you talk to your surgeons, they refer you so that within 2 weeks of the surgery, once the wound is sealed, you can come to see the plastic surgeons to treat the wound. And then there are other things that can be used, like there are silicone gels or silicone tips that can be put on the scar to suppress that effect.
Right. Let's remember, folks, that the skin is a living organ.
Yes.
Right? And you've done something to it. So some of these things are processes that should take place normally. You've interfered, and now that process is, should I say, in default, right? And all sorts of things happen, right? So we need to be mindful. Great question there. Good afternoon, Nortey. I had a second ear piercing for fashion in the UK around 2002. The back of the left earlobe developed into a keloid over time. I still wear an earring there, but if I wear it for a long time, it secretes some pus from the ear hole. And sometimes a small earring can get stuck there. What should I do? It started as fashion, but now we're into health.
Okay, yes. So what I do is that for the patients, when they come, I actually ask them whether they still want to keep the second hole or they want us to close it.
Okay.
So if they want to keep the second hole, it's still possible to deal with the keloid and still maintain the second ear hole. But the surgery is not the treatment, because surgery itself is trauma. Okay, and trauma is what causes the keloid in the first place. So the surgery is just to debulk it and create a normal appearance, and then you use the injections or any other means. So that we also use radiotherapy. Okay, but that's a different kind of situation. But we use that to kind of maintain it. So usually most people, after a number of injections, usually up to about 6 injections, spaced 1 month apart, usually they are fine. So for the lady who asked that question, you would need to have it looked at, and if it's bulky, we can be debulked and then create the proper hole for you, and then you can be managed with some injections afterwards, and that should be fine. The other thing is also there are some people who also react to some type of metals. So I mean, there are some women who are not cheap. When they wear the regular nickel and stuff, they react to them. So that also accelerates
high maintenance.
So that also
but they're reacting
to
the actual
metal. Yes, they react to the metal. So that accelerates keloid formation. Okay. And so for those they usually go for like gold, gold earrings and so on. Yeah. And then but the keloids themselves, when they get to a certain size, they tend to also, because the keloids are in the skin, and the skin has got these elements that produce oils, sweat, and so on. And so these secretions get embedded inside the keloid, and so they can become infected, and then you can get pus, formation and so on. Okay, so keloids can get infected as well. So whatever it is, when we see the patient, we evaluate. And then if the infection needs to be treated, we treat the infection and then handle the other things afterwards.
Okay. Long one from Prosper in Dakuman. Blessed day, not by nature, indeed trouble is invited by human beings. I just can't understand why we can't accept and love our body the way and manner we were created naturally. Sometimes the side effects are very frightening. I believe going forward we should start educating our kids right from basic level to orientate them in accepting how they were created. Nortey, I have a very flat buttock, but I have accepted it, and I'm very proud of it. Your only choice. Charlie, what will I do? That's what I have. This is Prosper on a lighter note. Dede is back.
But Prosper, man, what are you doing with big buttocks?
Prosper, this is from, please, Doctor. He's in charge of reconstruction. He's asking you what at all.
You should get big pockets
baggy pockets. I understand the black race is more prone to keloids. Why so? This is from the day in Maryland.
Yeah. Okay. So there's some genetic predisposition to keloids, and it's more common in black people. There's some recent studies found the ACNAC gene that is responsible for keloids. It's more common in black people. So that is one of the things. It's just like how
the black race. Because
yes.
the day is, Fanta. She's fair color.
Yeah. Yes, but once you black, not black as in. Because we have different black, we have different shades of color, but I mean, like genetically, yes, those who have African origin, yes, right. So we tend to have a more tendency to form keloids. It's just like how what do you call it? We have the whites or Caucasians are more prone to certain types of skin cancers,
right? But
we are less prone because we have got melanin that protects us from the ultraviolet rays from the sun. They are more prone to forming some types of skin cancers and getting a lot of sun damage from being under the sun too much. So it is one of those things that is a fact of life.
Right, Doc. We're running out of time, but having mentioned cancer, right, it's quite significant that thus far in the discussion, it hasn't come up. I've read a few worrying things. Are there any linkages, the materials we inject, the practices or processes and so on that may heighten our vulnerability to types of cancer?
Okay, yes. So far as cancers are concerned, well, ordinary, let's say, tattooing and body piercing is not known to be associated with. I don't have any evidence to say that it is associated with increased chance of forming a cancer.
Okay.
But what we do know is that the industrial dyes and pigments, when they are introduced into the body, they tend to increase the chances of forming cancers in the body. So that's the connection.
The relation.
So it's not the tattooing per se. But it is more like the type of pigment that you are introducing into the body, type of chemical you're introducing in the body that will predispose you to forming cancer.
Did they ask again, do keloids reoccur at the same spot after removal?
Yes. So if you have a keloid removed surgically, then you have to have another strategy to intervention to prevent that keloid from growing back. And that's why we talk about either you use the steroid injections or use radiotherapy or some other means. Some are using, there are the new type of lasers that are also quite effective in reducing keloid formation. So you must have a backup plan. But if you just go in and remove a keloid, 70 out of 100, the keloid is going to grow back.
Come back.
And it's not just going to come back, but like the proverbial Bible where it said if you cast out a demon, it will go and find 7 demons stronger than itself and it will come back and the person still to be worse than before.
Right.
The same thing happens with keloids. So if you just excise the keloid, and you leave it alone, 7 out of 10, it will grow back bigger and worse than before.
Okay, 1 minute you're dealing with the fruits, but definitely get to the root of the problem. Yes. And if you can nip that, then you won't have that recurrence. Also, I haven't heard, Doc, allergies. When we're doing all these tattoos, we mentioned people who should not typically be suitable for these things. What about allergies and allergic reactions?
Yes, so there are some people who have been known to develop hypersensitivity reactions to some of the dyes and products that are used for the tattooing, the pigments.
Okay.
And so and that will show, usually if you're getting that kind of reaction, to show by redness, itching, irritation at the sites of this, and it may be associated with some blistering fever and so on. It could also be an infection, but the hypersensitive reaction tends to develop over some days, But then, if you've had that kind of reaction before, okay, and you go in and you get that same dye introduced, then you get a more stronger reaction the next time around because your body has been sensitized the previous time, and so that is something to also look out for.
Okay.
And so once you notice that, you need to get to hospital so that you are giving some treatment so that it doesn't become something that overwhelms your system.
Okay. Last question for you on this one. So, in the absence of regulation and noting, even watching the World Cup, you watch UFC, people are tattooed head to toe. What should I be concerned about if I bear one of these, marks or body art and so on and so forth? Should I have myself checked in hospital to make sure everything is okay? If there's no localized swelling or irritation,
All
am
right,
I good to go?
Okay, so truth is that for most of the people who have got this tattoo that we see around, they did it some time ago and they seem to be fine. So in terms of health-wise, there's no acute situation as such. But it's those who want to go in for it that we should be worried about because they are now going to expose themselves, and you need to be sure of who you are going to and the kind of facility that is going to be done at and the standards that pertain there and so on. That's one. But for those who have had it and are having challenges with it, because there are some people who even develop hypertrophic scars and so on, keloids and other things. So, or recurrent. Some people get recurrent. Sometimes, what happens is that when you are tattooing, they tend to push. Because you're pushing the pigment deep into the skin.
Okay.
And sometimes you can also get something called an implantation cyst. You can get some cells that are supposed to be in the upper part of the skin being pushed deeper down, and then when they produce their secretions, these secretions are supposed to come out onto the skin. But then because they don't have any way out, it starts to get a collection. So you've had situations where people develop these cysts or collection of fluid within the tattooed area. And so these cysts will have to be removed surgically, because sometimes they can become infected as well, or just keep growing bigger and bigger and become uncomfortable. So they'll have to be removed. And so if they notice anything like that, they can report, and then we can deal with it.
Okay.
Yeah.
With removal,
Yes.
I said I was on my last question. But removal, I want to be rid of this.
Yes.
Is it possible? Tattoos and all that. I've heard the lasers will just fade it or thin it out. Is it possible? Just a brief answer on that.
Yes, so there are some type of lasers that help. What the lasers do is that they use focused energy, high energy, to break the pigments are heavy metals, so they break them into mini fragments, which are easier for the lymphatic cells in our body to get rid of.
Okay.
So with treatment, it fades over time. But the thing about lasers is that the lasers use a particular wavelength of light, and usually they work better in Caucasian skin because there's a contrast between the dark pigment in the dye and then the skin.
The skin itself,
the skin of the person. But in our black population, because you already have dark skin, so the targeting of the laser becomes very difficult because your color is also a bit on the dark side, so you get collateral damage to the skin happening with it. So a lot of black people, in fact, I saw a patient just last week who had gone for laser removal, and it basically just produced very unsightly scars, and so we have to look at another method of removing it. So lasers, the regular lasers don't usually work very well in black population subtypes, although in the white people it's been shown to effect because of the contrast and so on. Then the other ways that we can either do something called serial excision. Okay, some non-surgical means some people are trying to use chemical peeling and then dermabrasion and so on. But those do not work for the very professional tattoos because those beginnings are deeply embedded in the skin. Okay. But for the amateur ones, sometimes chemical peel and dermabrasion can work because dermabrasion is where you are just kind of sand. It's like you are using sandpaper on something, you know. So you can those can work for the amateur ones. So for the professional ones, usually either you get what you call serial excision. That's if you can't remove it all at once, you try and if there's looseness in the skin, you can cut out it in bits.
So over time you are taking
it out. Or sometimes you can remove the whole thing and put a skin graft in its place. But the difference is that when you put in a skin graft, the skin graft will not be as thick as the original skin.
Okay.
So you may get like a contour defect.
Okay.
But it depends on what the person wants. And then in the extreme, there are also things that we can do, something called tissue expansion, where we put in a balloon under the skin, an inflatable balloon, under the skin. All right, and this something
stretch the skin.
So yes, so we keep blowing the balloon gradually, and then we blow up the skin, create extra skin, so that when we cut out the tattoo, we have enough skin to close it.
Wow. Thank you. Went over time. I thought it was a brief closing point, but thank you very much, Dr. Opoku Wari Ampoma, consultant plastic surgeon. We're going to have to do a series with him, definitely. We've done a lot with him over time. Burns, keloids, and reconstruction. Indeed, I remember once we were asking him, is it really plastic? And then we got into all that business. Many thanks, Opoku and Akwaba. Welcome back.
Thank you.
All right, folks, I'm out of here. Stick and stay on Joy 99.7 FM, Ultimate Health. Ziggy takes over. I'm out.